Hello, my name is Dr. Gerald Chodak. In this video, I want to give you some suggestions on how to help improve side effects that can occur while you're under medical or surgical castration. I'm going to deal with the most common side effects in this video. Most commonly, patients complain of hot flashes. They break out in a sweat. For many men, it can be quite troubling, and the question is what can be done to help. And there are a number of options. One medication that has been available is a drug called megestrol, or Megace. This is taken twice a day, and at the doses used, it has few side effects, and it is something that can improve symptoms in a significant number of men. Other medications being looked at are drugs called SSRI medications, or selective serotonin reuptake inhibitors. They're basically antidepressants that have an effect on hot flushes. They haven't been approved for that purpose, but studies have been done to demonstrate that there is a significant number of men that will benefit from taking one of these medications. And so if you're having that problem, discuss that as an option, realizing the medicines are not approved for that purpose, but they are FDA-approved medications for other purposes, and you need to monitor potential side effects. What else can be done? There is some evidence or suggestion that unconventional treatments such as black cohosh have been available and potentially beneficial to both men and women complaining of this problem. But the truth is that scientific studies done in a randomized fashion have failed to show a significant improvement with the use of that alternative medication. Similarly, some people have suggested that soy products may have a benefit, but there too the data is rather lacking. So like anything else, you can try a variety of options, but don't go spending a lot of money on these unconventional treatments that haven't been shown to show a real benefit. Okay, what's the next complication to deal with? Well, many men deal with problems of weight gain. They gain that weight in their midsection, it takes away their energy level, and they feel fatigued. So a couple of things that you can do. We know that your metabolism is going to slow down, so the amount of calories that you're going to need is going to diminish. Also, we know that exercise programs can help in this regard by helping to balance the weight and also restore some of the energy. I recommend people starting to talk with a nutritionist who can help evaluate your diet and plan out a diet that's going to fit for your needs in order to help with your weight management. Another problem that can occur is osteoporosis, or thinning of the bones. The consequences or problems with that is that men can develop fractures, and if you develop a pelvic fracture, you actually have a higher risk of dying from that than you do from dying of the prostate cancer itself. So there are a number of things that are helpful here. Number one, if you take caffeine, or if you smoke, or you consume much alcohol, all three of those have been shown to have an impact on the progression of osteoporosis. We know that many men don't have enough vitamin D in their body, and that can be monitored. Also, for men that are going to go on this type of therapy, you can take calcium in the amount of about 1,000 milligrams a day, and also vitamin D supplements in the amount of 400 international units per day. And that can delay or decrease the amount of bone loss that occurs. Now, when a man is going to go on therapy, we can do a study called a bone mineral density study that will tell us how their bones look and whether there is a sufficient loss of bone activity already. If so, we also have medications that have been approved. They're called bisphosphonate therapy. Those are currently mostly taken intravenously, but some oral medications are available. They just haven't been studied as well in men with prostate cancer on hormone therapy. There are new medications under evaluation that can be taken orally, and hopefully we'll see if those become approved sometime next year. So those are ways you can help yourself. Also, studies have shown that resistance training, weight training, under a supervised program can help in several regards. It can help maintain strength, it can help maintain muscle mass, which is a side effect of this treatment, and it can help with your strength and help minimize the potential for getting the osteoporosis. So there are a number of things that can be done to help minimize this problem from developing. The next problem is something called the metabolic syndrome. It's a number of things that happen as a consequence of the therapy. It includes increases in your glucose level, increases in your LDL, your low-density lipoprotein level, your cholesterol level. Your triglyceride level can raise, also bad for you. And you can have problems with hypertension, and another thing you can develop is anemia. All of those are related to the side effects of the hormone therapy. And while we can't necessarily prevent those from happening, what we can do is keep you carefully monitored so that while you're getting your hormone therapy, we look for those by measuring blood tests, measuring your cholesterol, measuring sugar, measuring your blood pressure. And if there is any evidence of some of those things beginning to change, then we can apply appropriate medications to help you in that regard. So this is something that is increasingly becoming common knowledge. Many doctors, however, still don't do it. So if you're on hormone therapy, ask your doctor about checking those things, either with your urologist or your family doctor, so you have the best chance to avoid that from happening. And lastly, I want to talk about sexual function. Clearly, men who go on castration have to face the problems that their sex drive will go down as their testosterone level goes down. We don't have a good solution to that other than to offer you a holiday from your treatment. But in terms of treating the problems with your loss of desire, we don't have a solution for that. On the other hand, if you are still interested in having sexual activity, but your erections are diminished, we have a number of treatments available to help improve erections, from oral medications to injectable medications. And for some men, penile prostheses are also an appropriate thing to do. The bottom line here is to have this on your mind and converse with your doctor about the various options for treating each of these different side effects. Our goals are not only to maximize your survival, but to do as much as possible to improve your quality of life while we're treating your cancer. Hopefully you'll find this information useful. Thank you.